Hi, welcome to EMDR with Alice. Today we're going to talk about the difference between reenacting versus reprocessing. And how do you recognize that with your clients and what's happening in the session? And so first of all, let's talk about reenacting. So reenacting is essentially when a client is in their trauma responses and they're really out of their window of tolerance and they're reenacting the trauma experience. So versus reprocessing is where they're in their window of tolerance, maybe they're activated and there are trauma symptoms present, but they are present. They're present with you and there's movement happening where they're moving into more of an adaptive state. So let's talk a little bit about what reenacting may look like in the session. So reenactment might look like somatic movements that are happening over and over, and they're not shifting or changing. They're not getting worse. They're not getting better. They're just kind of staying the same over and over and over. Another kind of reenactment example would be a dissociative response where a client might be feeling really floaty, feeling checked out of their body, and they're not fully present with you. You can tell they're kind of out of their window of tolerance. That's another example of reenacting. Sometimes also reenacting can look like getting really agitated or really maybe confused or distracted in the session. Like they'll kind of say things like confused about what they're supposed to do or real distracted by things that are happening outside of them, outside the office doors that they're really hearing, or distraction in their head. And again, it's not moving. So there's not adaptation that's happening. Every time you check in, it seems to be about the same. Those would be examples of just reenacting kind of the trauma. I've also seen reenactment happen where a client they go into the abreaction of crying and big emotions, but instead of it kind of doing what it normally does when a client's having abreaction of kind of a crescendo where the abreaction gets really big and then they kind of seem to kind of come out of that and do less of a cry. They crescendo, but then they plateau. They stay up in a just kind of an overwhelmed cry, or sometimes it's a silent cry, much like what would have happened at the time of a trauma where they're almost little while they're crying and trying to stay really quiet and really hidden. So all those are examples of reenacting. If that's happening in your session and you're picking up on that, then all we need to do is just kind of pause the bilateral, invite the client back into the present moment with an orienting response, kind of inviting them to take a moment to look around the office, name things they see in the office. I often have plants. You can see the plants in the background. I'll say, can you count how many plants you see in my office? And then I'll ask them, what do you hear? Can you tell me the noises you hear outside my office door? And what's a noise that you can hear inside my office? So just begin orienting them to the space. That invites them to get that 1 foot back into the present so that we can continue on with reprocessing. Again, the difference with reenacting versus reprocessing is when we're pausing and checking, doing that feedback portion of what are you noticing now, the client is giving us information that indicates movements happening. And if we take a step back and we evaluate kind of the last couple check-ins over the last maybe 5 or 6 check-ins that we've had with the client, we're hearing more adaptivity. So they're more adaptive in their responses. Maybe they're shifting their perspective. So they have from a childlike perspective to more of an adult perspective. Or maybe it's more adaptive in terms of the somatic experience where it's gone from tense or tight or pain to loose or calm or feeling more at ease and more relaxed. So those would be examples of adaptive responses. So keep an eye out, noticing the difference between reenacting versus reprocessing. If you catch reenactment happen, it's okay. Just pause the bilateral, invite the client back into the present using an orienting or grounding experience. And then once they have kind of rejoined back to the present, they're back connected into their body, into the present moment, into the office, we can go back in and finish up phase 4 just by asking, what are you noticing about the memory now? And follow my fingers. And just when you re-enter back into that next set, do a shorter set, maybe go a little bit slower, and see if that helps them stay in their window and keeps movement happening. And then also keeping in mind, they may need a cognitive interweave here. And so go a set or two, and if it still seems to kind of be stuck, consider a cognitive interweave to help move it along. That's our tip for the day on identifying reenactment versus reprocessing. Thanks for joining.